The last thing that I want to talk very briefly about are the research methods that are specific to studying development, as well as some of the things that we need to consider or keep in mind when we're looking at human development. So, the first thing we're going to do is look at two of the basic types of research that are specifically set up to see how we change over time. These are longitudinal research and cross sectional research. Now, longitudinal research involves looking at the same child or the same group of children as they grow and age. So, here we have an example where child A is assessed at 6 months of age. Then we look at that same child or group at 12 months, and then 18 months, and then 24 months. So we could look at how their, say, preference in listening to music does something over time, or something like that, whatever you're looking at. So you could do a study where you follow the same child over long periods of time. This kind of a design gives us lots of unique information about those developmental processes, and because they're conducted using the same children, we know that there aren't other factors influencing, or at least there's fewer factors influencing. So we know that it's something that is specific to those children or changing over time as they move through and develop. Our other option is cross-sectional research, and this is where we look at multiple different children who are different ages. So instead of looking at the same child every 6 months for 2 years, you would only measure, say, a different child at each time period. So we'd look at one child who's 6 months old, one child that's 12, 18, and 24. So we could look at the same kinds of research questions, but here we could collect all of that data at once, which could help us examine how children tend to behave at that particular age, but it doesn't give us a lot of information about development within the same person over time. You can also have, I think they're called cross-lag studies, where you do cross-sectional research, but at multiple periods. So it's a little bit of cross-section and a little bit of longitudinal studies, and it gives you the best of both worlds. But there's lots of variations that you can have on these. The thing that we want to consider is that with longitudinal research, we've looked at someone across here 2 years of their life. So we'd have to measure the same child for different periods. So they would have to stay in the same area and have to be willing to continue participating in that study for those 2 years. And they would have to, like, all sorts of different factors. So in practice, when you conduct longitudinal research, you tend to have a lot of participants drop out. It also takes more time because you have to wait 2 years for the child to hit that last measurement stage. In contrast, our cross-sectional research, we can measure 4 different children all at once, and we can get that data much more quickly with a lot less time and effort. But again, we're now looking at different children, so now we have to take into account how these different children might differ from each other, unrelated to development. So there's extra factors to consider here. So sometimes you're limited based on, say, time or resources, and sometimes it depends on what exactly you're looking at. Is it important that you look at the same children over time, or can you get away with a cross-sectional setup? And again, we could go into lots more detail here, but we'll continue on. I have mentioned earlier on in this class or in this lecture about how it's very difficult to study behaviors in individuals that can't tell you what's going on. For myself, where I've done research with non-human animals, we have the same problem, where you're asking questions and your subjects can't tell you the answer. So if we're looking at infants, we have to find a way to ask a question and get a reasonable answer without them being able to verbalize a response. And one of the ways that we can do this in infants is to use high amplitude sucking paradigms. This is basically the idea that infants will suck on a pacifier. They have that reflexive behavior that I mentioned earlier on in this chapter, where they will suck on a pacifier if they're presented with it. And they will usually suck on that pacifier at a consistent rate. So if you measure their base rate of sucking and then expose them to different stimuli, maybe you show them an interesting picture or a scary picture or something new and exciting or something boring and that they've seen before, they'll change how much sucking they're doing per unit time. So the rate will change. And that change in rate shows us that they're paying attention to the thing that they've been shown. So if we see an increase or a decrease in sucking, then they're paying attention to the thing that they've been shown. So we can make some assumptions there on attention and what they're focusing on versus what they choose to ignore. We can also use habituation paradigms. And this is the idea that children, infants in particular, will get used to stimuli that they see a lot of the time. They have more of a reaction to novel stimuli, things that they've never seen before. So if you show them a face, a boring face that they've seen lots and lots, they might glance at it quickly, but they're used to it, so they'll look away fast. But if you show them a new face, a face they've never seen before, they might look at it for a longer period of time. So we can look at that gazing time, or how long they look at something, and we can determine if they recognize something or if it's novel. So is it familiar? Is it something they know they've seen before? Or is it something new and exciting that they stare at for a longer period of time? And there are situations where children will violate these expectations. And even the existence of these paradigms, once we started studying things using these paradigms, this is some of the evidence that made us see that Piaget's stages might not grasp some of the abilities that infants have much younger than what he thought. So there's lots of caveats here where there are other things going on, but these are some of the things that we can look at when trying to do developmental studies. So this is reflexive behavior. What about voluntary behaviors? What about, instead of just looking at things that happen automatically, what if we start looking at things that children choose to do? So we can look at false belief paradigms. And these are things like we've already talked about, where we have that concept of theory of mind. So the child looking at a box of raisins, or a box that says it's full of raisins, but they know that it has crackers in it. If a child passes that paradigm where they would say that somebody new, someone who hadn't been shown this box before, would assume that it has raisins in it, we could say that the child has passed that test, that they are showing evidence for a theory of mind. And this is basically an understanding that others have feelings, thoughts, and desires that differ from their own. So they're no longer focused on what they themselves know, but they have a concept that others can have different ideas and different thoughts and experiences that aren't the same. We can also look at elicited imitation paradigms, which is basically a memory test that doesn't involve them telling us that they remember something. So one of these examples would be if you show a child a bunch of blocks, and these blocks interact, but you don't show the child how they interact. You just let them play with them independently until they get bored. And then once they've gotten bored of those pieces, you show them that they can assemble them together into a particular shape. Maybe you can put two cups together with a block inside to make a shaker. And once you've shown them that that's something it can do, you can bring that child back a couple of weeks later, a couple of months later, or even a year later. And if they assemble those pieces the way that they were shown, that shows that they remember having seen those before and know that they can put those together. So again, another way that we have evidence that Piaget's initial ideas are those things would have happened a lot sooner than he thought they would have. Another thing we want to consider is when we're getting a lot of data to do with developmental studies, most developmental research relies on questionnaire data. We do see some behavioral measures. Maybe you'll send someone to a school and they'll record behavior in a classroom. But a lot of times we'll have questionnaires, and these are usually sent to parents, and we'll ask the parents how often their child does a particular behavior, or does your child know this thing? It's a very useful tool because the parents spend lots of time with the children, and so they can give us a pretty decent understanding of what the child is doing. But the problem here is that we have issues like fallible memory. So maybe a parent forgets that something has happened, or they think that something happened, but it hasn't really. There's also cases of bias where parents assume that their child is more advanced than they really are. So maybe they stretch the truth on their questionnaires. So we need to keep some of those limitations in mind when we look at questionnaire data. We can also briefly touch on ethical considerations. We've already talked about this back in chapter 2, but again, keep in mind that all research would have to be approved by an institutional or internal review board, an IRB. So you can't just do developmental studies, you need approval first. We also focus in on consent from parents, so informed consent in particular from parents, and parents and guardians of children, because the children themselves cannot give informed consent. So we need someone who can speak on their behalf, but we also need assent from some children if they're old enough and we can ask them if they'd like to participate. It's usually important that we ask if they're okay with doing it. And we also need to know that debriefing after studies is also a big thing with developmental research, as well as other kinds of research too. So just a little refresher of our chapter 2 discussion. And then the last thing we want to have here are some of our practical considerations. So there are a lot of difficulties associated with even finding participants. So we mentioned the fact that it might be unreliable to use survey data. Well, sometimes surveys are the best we can get. It's hard to convince people to come in and participate in studies. It's very difficult to get, especially stuff with children, having parents come into the university to do tests. Not everyone's going to agree. And when you do get people to come in, you can end up with biased samples or homogeneous samples where you don't get a variety of people. Usually, especially with young children, you're going to be advertising at, say, doctor's offices or hospitals where children would be born or treated. And then you're only going to get the people who see those flyers, but also only the people who can afford to take the time to bring their children in for these studies. And these limits of our studies cause problems with our generalizability of our research findings. So if we're only getting, say, upper middle class people coming to a study, then are we sure that these findings would apply to people of all socioeconomic statuses? We can't be quite certain until more studies are conducted.